Congenital heart disease means that a patient is born with a heart defect, and there's many different types. Some are less severe, some are more severe. Some do not require surgery, some do. Some require therapy in the cardiac catheterization laboratory. Some get better on their own. So there's many different types, but our program here, we are a full service program, so we have all of those services. We have a cardiac catheterization laboratory, electrophysiology laboratory, surgical services, of course, an intensive care unit specific for cardiac patients. So we do offer all that for all the different types. We actually meet children before they're even born. So we have a fetal cardiology program where we do echocardiograms on pregnant mothers and identify if the fetus has a heart defect, so that if it's something severe, we can be prepared at the time of birth to properly treat that child. Personally, I've operated on children on their day of birth. Certainly in the first week of life, there are many congenital heart lesions that require a heart operation during the first week of life, and then the range extends all the way into adulthood. So we operate on adults that were born with congenital heart disease. So different than my adult heart surgery colleagues that do coronary artery bypass grafting, and I do operate on some adults, but their heart disease is specifically the type they were born with. Normally, most of these patients see the cardiologist first, and that's where they receive their diagnosis. And then we, every week we have a conference, a cardiologist and the surgical team, where we discuss patients that may need something done so that we can make a group decision on what the best course of action is. If we decide that they need an operation, then they will visit me in clinic. Usually we can schedule the patient and they'll visit me the day before the operation. And we'll discuss the operation, so what to expect in the operating room, how long the operation will take, how long the hospital stay will be, what the risks, benefits, possible complications are. The day of the operation, they'll be asked to come in early that day. We do the operation. We normally go through the sternum, so we open the middle of the chest, and we use the heart-lung machine to support the body and provide oxygen and blood flow to all the organs while we stop the heart. And even if it's on the blood vessels directly outside of the heart, we often stop the heart. But the heart-lung machine allows us to do that and allows us to provide blood flow to the rest of the body. And so we do the various repairs and then get the heart beating again and come off the heart-lung machine. We check our work with an echo before we leave the operating room. The idea is to leave with the best possible repair. And so we check our work with echo, and fortunately, most of the time it's just fine, and then we're able to sort of close the sternal bone and close the skin above it, and then head up to the ICU. The child goes directly to the intensive care unit, and parents are welcome to stay 24/7. They're welcome to participate in daily rounds with the intensive care unit team, and we keep them up to date on all the different things going on, and each day try to give them a plan for that day, and also comment on the big picture plan on when they might go home, and if there's something else that we need to do, other tests, etc. We have children in the hospital as little as 2 or 3 days, and as long as 30 or 40 or 50 days. And so some of the more severe heart lesions stay longer. They're more on the 1 to 2 month time frame. And then some of the more straightforward ones, many of them are in the 2 to 5 day or 3 to 7 day range. And then once they're discharged, they usually follow up with the cardiologist in the first 7 to 10 days. And we, on the surgical side, we normally follow up with them via phone, and sometimes have them send a photo of their skin incision to a secure phone that we can place that photo in their medical chart and keep up with that. Of course, we're happy to see them anytime afterwards surgically if we need to. Kids do much better than adults. Most adults after heart surgery don't quite feel like themselves for probably 2 to 3 months, even if they're walking around, and children bounce back quite quickly. But it takes 6 to 8 weeks for the sternal bone to heal. And so children that are playing sports or that go to school or can hang on a gym in the backyard, we ask them not to do that for 6 to 8 weeks. Small babies, newborns that we operate on, there's not many restrictions. We ask the parents to hold the child a little differently for 6 to 8 weeks, but then can really, do what they please. Children can be on their stomachs. The babies can have tummy time. There's not many restrictions, to be honest. Kids do quite well. If your child's having open heart surgery, that's definitely a big deal. And so what I try to tell the parents, first of all, we're always very honest with them and very direct, and but we do it with compassion. And the reality is that if you look at every congenital heart operation, the overall mortality, so the risk of dying, is probably 3% or so, 3 or 4%. Now, there are some heart lesions that it's close to zero, and then there are some heart defects that it's 30 or 40%. And so it's a very individualized conversation depending on the heart lesion. But most of the heart operations can be done very, very safely. And so I try to tell them, here's all the things that could happen, but if you step back and take the 10,000-foot view, none of that is really that common. I mean, we're talking like low single-digit percentages. So, and I try to end with some positivity and some hope, because that is the reality. That look, your child has a 97, 98, 99% chance of coming through the operation just fine, going home, and doing great. And of course, we'll tailor that if the child has a really serious defect and maybe the heart function is poor, then it's a different conversation. But by and large, I find that the parents are reassured after we speak with them. And we have a great team here. We do the full spectrum of pediatric heart disease. So from the most severe single ventricle lesions, so kids that are born with just one pumping chamber, not two, and most of these children can go on and live very happy, fruitful lives, and their parents get a lot of satisfaction out of that. We will never give up on their child, and that their child's in great hands, and that we would do everything that we possibly can to get their child through. And we have a track record of doing that we from the easiest things to the most complex things, I feel confident. I would tell them that I feel confident that we can help them.